We'll be sharing some of the lessons from Suara 2 program in Nepal, and particularly the dietary outcomes are closely related to the behavior change in the households. That's why we'll be focusing on Suara's behavior change platforms and their impact on the maternal and child dietary diversity. So I'm sharing this presentation on behalf of all the authors. Some of them are in this room. Kenda is moderating the session. I can see Poojaji there. Bhimji is here. And also I'd like to remember those who are not here is Salini Suresh, Anne Paxton, and Minraj Gyawali. They are not here, but I'm presenting on all their behalf. So to start with, some of you have already the idea of how Suara works, the scale of its operation. So it's a continuation of Suara 1 program that runs through 2016 to 2021 March. It's funded by the USAID. We work in 77 of the 42 districts. There you can see the colored districts. We are also doing by the face there. And we have very ambitious target of reaching 1.5 million households in the 1,000-day period. So ours is a multi-sector program, and we work on nutrition, health, family planning, WASH, agriculture, gender and social inclusion, and nutrition governance. So as I said earlier, these are the behavior change platforms that Suara 2 is using currently. In the interpersonal communication level, we have the home visits by our field supervisors, or we call also the community nutrition facilitators. And in community mobilizations, we have group meetings that includes the health mothers group, and we have village model farmer group meetings. We have key life event celebrations. We have community fairs, radio contests and awards, and food demonstrations. And in mass media, we currently use many now, but for purpose of this research, we are just evaluating the Bhanchina Ama radio program, our flagship program, but also we are using currently the push messaging, SMS push messaging, video for frontline workers, and also we are working on social media. So about this study, we use the data set from Suara 2's annual survey that we conduct every year, data set of 2017. It's a multi-stage cluster sampling using PPS that includes districts, municipalities, wards, and world wards. And 3,635 households were randomly chosen. And the data was collected by New Era in June to September 2017. And we also received ethical approval from the National Health Research Council. Our objective was to investigate the associations between exposure to Suara 2 and maternal and child dietary diversity. And we used linear regression for dietary diversity scores and logistic regression for meeting minimum dietary diversity. And as I said earlier, the exposures are 3 types of exposures: interpersonal communication or home visits, the community mobilization, and mass media. And we also looked at any exposure and multiple exposure, or exposure to multiple channels. And the outcome would be maternal and child dietary diversity. And we also consider the confounding variables that I'm going to say in the next slides. So for dietary diversity, we used the globally recommended food groups, like 4 out of 7 for child, and 5 out of 10 for women's dietary diversity. This is the presentation that I was referring. This is the slide that says the composition of our respondents. So looking at the scale of exposure, it was the first year of Suara 2 program, and we had just 35% of exposure to Suara 2. Out of which, 26% mothers said they had exposure to only 1 platform, 7% said they had exposure to 2 platforms, and 2% said they had exposure to all 3 platforms. And here is disaggregation by the platforms. So the home visits at 11%, The community mobilization has 13%, and Banchinama radio program had 22%. And combining all this, NE had 35%. So the result of exposure and the maternal diet is even any exposure to any platform would have positive association. And then out of the 3 platforms, the community mobilization had the strongest association among 3 types of interventions. And also we found some evidence of association for home visits, but we didn't find any association between mass media and maternal dietary diversity. So similarly for children, the case was different, like the mass media had association with child dietary diversity. And on the scale of exposure, exposure to how many channels would have effect on the dietary diversity. So mothers exposed to all Suara 2 or all 3 types of these interventions were more than 2 times likely to meet minimum dietary diversity, and their diets in average more diverse by half of food group that you can see here. And for children, again, we segregated between 6 to 24 months and 24 to 60 months. Here we didn't find any association between exposure to the platforms and the younger children between 6 to 24 months of age, but we found some association between exposure to multiple platforms and the child from 24 to 60 months of age. So the takeaway key findings from our study is the positive trend of improved dietary diversity with increasing exposure to Suara. As we have more exposure, the dietary diversity also increases. Percentage of population exposed to Suara 2 seemingly low, as we said, is 35%. But we should also take in consideration that we had 625 field staffs, and here we are not taking into account their exposure to other frontline workers that work through the government system like FCSBs. We are considering only the frontline workers employed or mobilized by Suara 2. And results suggest that a multi-pronged intervention package is necessary to address poor maternal and child dietary diversity. So exposure to only one platform may not have the impact. Barriers to behavior change differ between maternal and child diets. That's why different exposure to different platforms would have different results. And importance of interpersonal communication as an exposure platform for behavior change, that particularly for increasing maternal dietary diversity. So that was, as I said earlier, that was the Suara 2's first year. And then in second year, on the basis of these findings, we did some changes to the program, and we increased our frontline workers. Additional 825 workers were recruited and are mobilized. So, and we are massively doing the promotion of Banchinama through non-radio channels as well, like stickers and SMS, Facebook, and YouTube as well. So localized production of Banchinama, so to make the more ownership of the local stakeholders, we did the Banchinama is now produced locally by the 14 FM stations in 14 different clusters, and that will be hooked by other FM stations. And we have also increased the number of community events like Posin Chautari, and we have Key Life events. And we are focusing on regularization of the community events, group meetings like Health Mothers group meetings. Also, through our frontline workers. The frontline workers are supporting the FCSBs to regularly run the HMG meetings. And we're also increasing the number of platforms that I showed in the beginning that currently we use. Besides radio, we also use other mass media and technology-based channels like SMS push messaging we have introduced. We have the IVR system for family planning. We have Facebook page now. And Facebook and YouTube is also to as Poojaji was sharing yesterday, that the demographic is changing. Mothers, 96% households had the mobile phone ownership, and 40% of them reported that they have the smartphone with an internet connection. And the more young mothers, like the mean age of young mothers will be 24, 26 years. That's so to address that, we are also trying to look we are also utilizing the social media, Facebook and YouTube as well.